So good afternoon, everyone. On behalf of Project Firstline, I would just like to welcome you all to part 2 of our interactive series called Fidgety Felix. If you attended part 1, welcome back. And if you are just joining us here for the first time and missed the first part of the session or series, do not worry, the sessions do not rely on one another as we go forward. So this is a 30-minute interactive infection control session, and your participation throughout the course in polls and through the Q&A will help make our content a little more lively and fun. So before I introduce myself, I would like to direct your attention to the chat box to find the link to our pre-session survey. Please take a minute to fill this out if you haven't already done so. In order to receive your certificate of training, you will need to complete this. So my name is Allison Thurber, and I'm a nurse at the Rhode Island Department of Health in the Center for Acute Infectious Disease and Epidemiology. And I'm a prevention training liaison for Project Firstline Rhode Island. I have a diverse nursing background in acute pediatric, inpatient, and emergency room care, pediatric chronic care, home care, psychiatric care, and infectious disease. I invite you all to enter your name and organization you are from in the chat box. You can also enter your email if you would like to be put on our distribution email list for future sessions if you haven't or don't receive those emails already. I'd also just like to take a moment to take Abby Anderson, our Project Firstline staff, who's behind the scenes posting information for you throughout the webinar and running the whole webinar. So thank you, Abby. This session is brought to you by Project Firstline Rhode Island within the Center for Acute Infectious Disease and Epidemiology at the Rhode Island Department of Health, in partnership with CDC. So for today's agenda, we will do a welcome and introduction. We'll go over session objectives, go through our interactive infection control session, and then we will have some important announcements, end of session feedback, and Q&A all wrapped up in a little half-hour package for you. So our session objectives today are to understand how infection control actions can prevent infection, know when to clean your hands and what method is appropriate for that task, and identify infection control risks and decrease them. All right, so when healthcare tasks take a turn, are you ready to take the infection control challenge? So once this session begins, the chat box will be turned off. Please put any questions that you may have during the session in the Q&A box, and then at the end, we will answer and discuss any questions or comments during our live Q&A. All right, so let's jump right into this challenge. For each infection control slide, a poll will pop up with options that match the screen before you, with some actions to choose from. You can go ahead and select the best answer on the screen and hit the enter button. All selections are anonymous to panelists and attendees and will show up as a total percentage when the poll is closed. I will then discuss and select the best answer, the highest percentage, and then we'll go from there. So you have this patient, Felix, who is a young boy who's admitted to the hospital. Many kids are anxious to be in the hospital and scared, anticipating, what they don't know or what they do think will happen. And Felix came to the hospital needing an IV. So he's in front of you, he needs an IV. What would your very first action be? And I'll give you a few seconds to think about your answer and select an option on the screen. Would you use hand sanitizer? Would you put on a mask? Would you insert an IV? Would you put on the gloves? Would you put on a gown? Would you disinfect Felix's skin? Would you dispose of used supplies? Or would you wash your hands with soap and water? So our poll screen has popped up. Go ahead and select your best answer here. I'll give it a few minutes for everyone to take that opportunity. Alrighty, so it looks like we have a few things people were tossed about. So number one answer here is wash your hands with soap and water. We have some that say use hand sanitizer. A little bit below that, we have put on gloves, and then we have put on a mask. So let's go with the highest selected answer, which is wash your hands with soap and water. See where that gets us. All right, so that one is correct. You can either use hand sanitizer or wash your hands with soap and water. It is important to clean your hands to remove germs before you insert an IV. Hand sanitizer is slightly better at getting rid of germs, but washing your hands with soap and water is still a great option. So an alcohol-based hand sanitizer is generally recommended for healthcare workers by CDC in most situations because it has been associated with higher rates of compliance, and sinks are not always located conveniently nearby. That said, in this situation, either option will work great. So now that your hands are clean, what is next? Would you use hand sanitizer? Would you put on a mask? Would you insert an IV? Would you put on gloves? Would you put on a gown? Would you disinfect Felix's skin? Would you dispose of used supplies? Or would you wash your hands with soap and water? Go ahead again and put your answer in for our second poll. Okay, so it looks like the majority put on gloves. A few put that they would put on a mask. A few put that they would put on a gown. And then we have someone who said that they would use hand sanitizer. So let's go with the most common picked choice, which was put on gloves. And that is correct. So inserting an IV can expose you to blood that might have germs in it. So to protect yourselves and protect your hands, you should put on gloves. That being said, as we go along, if you have any questions that why it wasn't a certain answer before another one, please put that in the Q&A box. And again, we'll answer those at the end. So we've washed our hands and we've put on gloves. Great. So our gloves are on. What is our next step? Are we going to use hand sanitizer? Are we going to put on a mask, insert the IV, remove gloves, put on a gown, disinfect Felix's skin, dispose of the used supplies, or wash your hands with soap and water? Go ahead and take a moment to fill that out. Remember, your end goal is to put in this IV, and Felix is a young child. He's there with you. You have washed your hands and you've put on gloves. What do you do next? All righty. So the largest percentage you guys can see picked disinfect Felix's skin. Some said put on a mask. Some said put on a gown. And some said insert the IV. So let's go ahead and pick that 72% that said to disinfect Felix's skin. That is correct. So our next step is disinfection. It is important to kill germs that might be on Felix's skin before you insert that IV so that the needle doesn't push those germs into his body. All right, so we've washed our hands and put on gloves and disinfected. And then as we're getting ready to insert that IV, you notice that Felix is rubbing his arm where you just disinfected. This is pretty normal in the pediatric population. You do something and then something unexpected happens, or maybe expectedly unexpected, right? So what do we do next? Do we use hand sanitizer? Do we put on a mask? Do we continue to insert the IV? Do we remove our gloves? Do we put on a gown? Disinfect Felix's skin? Dispose of the used supplies? Or wash your hands with soap and water? You should all see that poll pop up where you can select your answer. All righty. So it looks like the largest percentage of folks picked disinfect Felix's skin. Some said to continue to insert the IV. Some said to put on a mask, and some said to dispose of used supplies. So we are going to go ahead and pick, again, the most common answer would be to disinfect Felix's skin. Let's see how we did. Correct. So we are going to disinfect his skin again. Once a disinfected area is touched with something that is not sterile, like Felix's hands, you can assume that the germs have been spread to that area. And that means that that area then has to be disinfected again before you insert the IV. By inserting an IV, you are creating a pathway for the germs to enter the body. And germs can normally live outside the body without causing harm because the skin works as the barrier. But if they enter the body, for instance, through a puncture in the skin, they could potentially cause infection. All right. So let's summarize because we've got a lot of steps down so far. We have cleaned our hands, put on gloves, disinfected twice now. What step is next? Are we going to use hand sanitizer, put on a mask, insert the IV, remove gloves, put on a gown, disinfect Felix's skin, dispose of used supplies, or wash our hands with soap and water? Go ahead and select your best answer on this poll. All right, so 21 out of 27 people say that they would insert the IV. A few said put on a gown. A few said dispose of used supplies. And then one said go ahead and use hand sanitizer. So we're going to start with insert an IV and see if that's the correct choice. And it is. We can finally insert the IV. You have killed the germs on his skin by disinfecting, then re-disinfecting, and now it is safe to insert the IV. So the IV is inserted. What's next? Do you use hand sanitizer? Do you put on a mask? Do you insert another IV? Do you remove gloves? Put on a gown? Disinfect Felix's skin? Dispose of used supplies? Or wash your hands with soap and water? Take a moment to select your answer for poll number 6. Alrighty, so it looks like the large majority picked dispose of used supplies, and second, a few had picked remove gloves. So let's go ahead and select dispose of supplies, see if that's our answer. And it is. So it is important to throw away used supplies to keep others from being exposed to Felix's blood. Be sure that you put the needle and other sharps in the sharps container. So to avoid any unintentional needle sticks and exposure to bloodborne pathogens to yourself or others, you should dispose of any used needle or sharp immediately after use. Do not wait to remove your gloves or clean the area or hand off the sharp to another colleague to dispose of. Alrighty, so we have disposed of our used supplies and the IV is in. What are we doing next? Are we using hand sanitizer, putting on a mask, inserting an IV, removing gloves, putting on a gown, disinfecting Felix's skin, disposing of used supplies, or washing our hands with soap and water? Go ahead and select your best answer here. Give it a few seconds. So it looks like majority picked remove gloves. There's a few that picked wash your hands with soap and water, and a few that picked use hand sanitizer. So let's go ahead and select that highest choice there that everyone picked, remove gloves. Correct. Correct again. You guys are doing great. So after you throw away the used supplies, it is time to take off your gloves to remove any germs and blood that could have gotten on the outside of those gloves. Gloves are gone. What are we doing next? Hand sanitizer. Are we putting on a mask? Are we putting in another IV? Removing our gloves. Again, putting on a gown. Disinfecting Felix's skin. Disposing of used supplies while washing our hands with soap and water. Go ahead, take your best guess here. All right. So it looks like majority, very close majority, picked wash your hands with soap and water. So we had 50% of folks picked wash your hands with soap and water. About 46% said that they would use hand sanitizer. And then we have one person who picked that they would dispose of used supplies. So let's go ahead and select wash our hands with soap and water. And that is correct. So, trick question, either hand sanitizer or soap and water, like that first scenario, works fine. So even if you're careful, when you take off your used gloves, you can still get germs on your hands that need to be removed. Hand sanitizer is a good option, but if you see any blood on your skin, any visible soiling, you should wash your hands with soap and water. So please remember that gloves are never a substitution for cleaning your hands. And every time you remove gloves, you should perform hand hygiene. Hand sanitizer, again, is recommended for most healthcare workers in most situations, but there are certain instances like when you're handling infectious diarrhea like C. diff, or when hands are visibly soiled, that hand washing with soap and water should be used. Now that you've cleaned your hands, it is safe to move on to the next task. Hopefully, Felix has some IV fluids running and some medication to help him feel better. So congratulations for completing this infection control challenge with me. So to recap, we have done a lot of steps to help prevent any sort of infection risks when Felix came in to get his IV. So we cleaned our hands, then we put on gloves. We disinfected Felix's skin. And then when he touched that area and we thought it could potentially be contaminated, we disinfected again to be sure we were not exposing him to any infection risk. We then inserted his IV, threw his used sharps out immediately, removed our gloves, and then cleaned our hands again with either alcohol-based hand sanitizer or soap and water. Soap and water, particularly if we saw that we had blood anywhere on our hands. So key takeaways from today's session. Infection control actions can prevent the spread of germs. Cleaning your hands helps decrease the risk of infection. If there is suspected contamination or an infection control risk, like when Felix touched his arm right where we were going to put his IV in, reduce the risk prior to moving forward and then continue. And gloves are not a substitution for hand hygiene. All right, so for those who are interested in certificates of training for this session, only when you have completed the pre-session survey, attended the webinar, which we are at now, and completed the post-session survey, you will be eligible for the certificate of training. The post-session survey will be emailed tomorrow, May 2nd. You can see in the calendar. Please complete this by May 8th at midnight. Then the certificate of training will be in the form of a PDF sent via email on May 11th. So again, it'll be emailed tomorrow, May 2nd. Please complete this by May 8th at midnight. And then the certificate will be emailed to you if all has been completed on May 11th. So please follow Project Firstline Rhode Island on social media, on Twitter, LinkedIn, Instagram, and Facebook for upcoming webinars and training opportunities. You can also find our recorded materials, Project Firstline CDC materials, and printable resources on projectfirstlineri.com. On May 15th, 2 weeks from today, Project Firstline will present part 3 of this 3-session interactive series. And this last session is called What's Wrong with This Picture? Again, it will be a lunchtime 30-minute session from 12 to 12:30. So please join Stephanie Doyle, Lisa Ledoux, and myself for this webinar. We would be so happy to have you again. These are the references for today's webinar. And lastly, before we get to our Q&A, we are continuously trying to improve our webinars and our process to meet the needs of all attendees. So if you could please help us out by providing some feedback in the quick survey on your screen, our Project Firstline team would really appreciate that. And now I will invite my colleagues, Lisa Ledoux and Stephanie Doyle, to join me on camera to answer any questions next at the Q&A. Again, a reminder, if you do have any questions or did have any questions as it went along, please enter those questions into the Q&A box as the chat feature is disabled. We look forward to seeing you again in 2 weeks for our 3rd session, and have a happy day.